I hope you can all hear me well. Maybe if it's not the case, one of the co-presenters can just inform me in the chat bar. To reduce the background noises, I will kindly ask you to mute your micro. This is the small icon on the top of the presentation. Can I let you do that? Small icon on the top of the presentation. Okay. Thanks. So my name is Amandine Frisetti. I am the CALP Ebola project manager. I've been working on that project research since the beginning, which is June 2016, and I will be presenting as well as facilitating the webinar. Today we have the chance to have 3 other presenters doing the webinar, and I will let them introducing themselves. Eric, would you mind to start?
Off mute. Good afternoon. I hope everybody is doing good. My name is Eric Clark. I'm the current corporate sales manager with Cellcom Technologies Limited in Liberia, soon to be Orange within the next couple of weeks. Recently moved back to Liberia last January, been with the company for a little bit over a year. So prior to moving to Liberia and working with Cellcom, I worked with a company called Verizon Wireless, which is one of the largest cell phone providers in the U.S. I did corporate sales, B2B sales as well. I guess my background, I graduated from the University of Maryland with a BS in finance, and I got an MBA in marketing and supply chain from Penn State University. It's a pleasure and a privilege being on this call, and I hope to share my experiences as well as learn from everybody else. Thank you.
Thanks, Eric. Danielle, would you mind introducing yourself? Okay, Danielle, your micro is off. Would you mind introducing yourself? I guess I will do it. So Daniel is actually the managing director of Splash in Sierra Leone. He has been the managing director since 2012, and during that period he has overseen the firm growth from an annual turnover of 150k US dollar to more than 4 million. Prior to this role, he worked with Manocap, the venture capital firm behind Splash, and he also worked on Wall Street with Lehman Brothers and Barclays Capitals. He holds a bachelor degree in electrical engineering from the Union College in New York and an MBA from Harvard Business School. And now it's time for our last presenter to introduce himself with Scott Liberatore.
Yes, hi, good morning or good afternoon to everyone on the call, and thanks for joining. My name is Scott Liberatore, and I'm here with UNHCR in Geneva. I've been here for about a year and a half, and previously I was managing an interagency cash preparedness project focused on joint feasibility assessments with WFP and OCHA and UNICEF, which included an assessment of financial service providers in some priority countries. And now I support UNHCR operations globally with the identification and development of cash delivery mechanisms. Previously, I worked for nearly 10 years with the Red Cross movement, both American Red Cross and IFRC. And during that whole time, I specialized in cash transfers. And additionally, I've worked with the Pacific Stock Exchange and Bank of America Securities, so I have experience with financial service providers. Over to you, Amandine.
Okay, thanks, Eric. So, two main objectives of the webinar today. The first one is to present the innovative solution and the technology used in cash transfer programming during the Ebola response, and to discuss about the added value of using that technology. So it will be a 90 minutes webinar with a maximum of 60 minutes presentation, and we will keep 30 minutes for question and answer. So for the question and answer, I will invite you from now to write it in the chat bar that you will find on your bottom right. If your questions are not answered through the presentation, we will take the time to do it at the end of the session. We will have different chapters for the presentation. The first one will be to give you an overview of the response. Then we will be focusing on the technology used in Liberia and in Sierra Leone. We will be speaking about the weaknesses and opportunities of the response, and then Scott will introduce us the CDMAT tools before the Q&A session. Okay, so let's start. Let's do a quick zoom on the Ebola crisis. So in December 2013, the first Ebola case is declared in Guinea, and within 6 months, the epidemic is spread in Liberia and Sierra Leone. After 2 years of intense crisis, 28,616 cases of infection and 11,310 deaths are recorded. Another important aspect of that crisis is that quarantine measures impacted greatly upon people to find food or to go to market to sell the product, meaning that the local economy was heavily impacted and that it created food insecurity. With its 102 million of dollars contribution, the Office of Food for Peace was a major actor in the food security response. And in the effort to speed up the response and relaunch local economy, Food for Peace and its partners embrace the use of cash transfer programming, answering to the need of more of 500,000 people in Liberia and Sierra Leone. So in that context, what is CALP doing? Well, in June 2016, CALP has been mandated by Food for Peace to document that response, to document cash transfer programming that was implemented during the Ebola recovery phase. And to do that, we have 3 main activities. The first one is the documentation report, which is already finalized and which is gathering all the information about the response, the cash transfer programming response. Then we have a case study about the use of new technology, and the case study is definitely supporting that webinar. And later on in 2017, we will be leading a CTP outcome analysis, aiming to capture the outcome the outcome of a response in a short, mid, and longer term for beneficiary, their household, and their community. So what about the use of new technology for cash transfer programming? Well, in this epidemic context, where there were a not-touch policy and beneficiaries were hardly accessible, it was pretty obvious for everybody that e-transfer was the perfect delivery mechanism, and all the implementing partners were really keen to do so. However, Liberia and Sierra Leone had very sparse facilities and only few service providers, meaning that the potential for proper e-transfer was very limited when the crisis occurred. So what were the main challenges for e-transfer? First, for sure, you have a very poor phone network coverage. In both countries, phone network was only available in main cities, and which is not especially the place where you will find most of the beneficiaries of a crisis. You also have very poor infrastructure, poor road network, and only concrete roads between the main cities, which sometimes were built even though during the crisis, and when it's the rainy season, make very challenging to reach the beneficiary. Important to say is that in alignment with that poor infrastructure, you also have poor power supply. And with a poor power supply, it's becoming also more challenging to implement proper transfer. Stakeholder capacity. For some of the implementing partners, as well as some of the service providers, it was the first time that they were implementing CTP or e-transfer. And due to that, capacity and awareness were not optimal. Another point, and the last one for that slide, will be the beneficiary literacy. It's important to mention that in both countries, less than half of the population is literate, and so have no access or do not know how to manage a phone, how to write text message, or to read it. However, despite those challenges, implementing partners came with innovative solutions to use technology in their cash transfer programming. And among 9 Food for Peace partners, 8 managed to use technology, and not only and specifically for the cash delivery, but also at various stages of the process. So as you can see on the table, only PCI did not use new technology for their cash transfer programming. So what happened in Liberia? Well, prior to the crisis and when Food for Peace partners started designing their project, only one service provider was offering e-transfer. It was Lone Star. And in that context, Save the Children and Advocate, in that context and also knowing the challenges, Save the Children and Advocate decide to launch what we call a clustering approach. So what is a clustering approach? Basically, it's when you ask your beneficiary as well as your agent, so Lone Star agent, to reach the same point where you have phone network coverage to proceed to the payment. So beneficiaries were asked to go to that pay point. They were giving their SIM card to the Lone Star agent who insert it in the phone, proceed to the electronic transfer, and then cash it out. One added value of that solution was to upload and immediately transfer the data to the service provider digital platform, as well as ensuring security and protection of the data. However, it's kind of important to highlight that that solution was very challenging, particularly the relationship between the implementing partners and the donors, as in terms of coordination and awareness, it was mainly new. And to develop on that, we can say some examples. So, for example, Save the Children beneficiary had some problem with their SIM card activation or deactivation, meaning that some of their SIM cards were allocated to the former owners. And these were due because Lone Star had 2 different entities. One is dealing with e-transfer and the other one is dealing with SIM card, and they're absolutely not coordinating together during that response or communicating, making the implementation of that system kind of very challenging. Another challenge was the Lone Star agent liquidity capacity. So NGO has to transfer the money to Lone Star HQ before the distribution. However, Lone Star agent had to come with their own money for the distribution and then to ask for reimbursement later on. But when you are working in remote area and not in main cities, it could be kind of challenging to find the agent with the right capacity for such a high amount of beneficiaries. And it appears that some agents were not able to make the entire distribution, and they had to end the distribution earlier because there were no more money. So to resolve that, Save the Children and Advocate have to assess in the field the capacity in terms of liquidity of the agent, and this was an additional work and creating delays as well. Another thing, it was the capacity of the platform of Lone Star in terms of number of transfers. There were some misunderstanding and mistakes about the capacity of the platform, and at one point the platform get freeze because it couldn't welcome enough transfer for the project, which did create delay as well again. In that context, we had Cellcom, which arrived in country and entered the market in 2015 and launched its e-services, e-transfer services Smile. And after some assessment, evaluation, and preparedness, we had Mercy Corp who tried that solution with them, and I will let Eric developing that with you.
Okay. All right, thank you. Okay, so we launched late 2015 and started our operations March of 2016. And over the time we had to build our agent network, develop super agents. Now, super agents, there's a difference between the super agents and the regular agents. The super agents are, those agents with that can handle anywhere from about 5,000 plus and onward. Most of the agents we had, where they could do 200 payouts to 500 or so. So that was the early stages of mobile money. But once we partner, by the time we partnered with Mercy Corp for the payouts, it was, we had a couple of super agents that had the capacity. So with Mercy Corp, I'll talk about the challenges. Um, what really helped with Mercy Corp was every single beneficiary gathered in one place, right? So we did the registration drive, and all close to was that 432 people came. We did the registration over, a couple of days to get some people finally registered. But then since MTN also partnered with Mercy Corp, you had people who were trying to collect funds from both Mercy Corp, from both Cellcom as well as Lone Star. So we found that early on before it became an issue, but that was something we had to deal with. But once we started to pay out, a couple of times the smaller agents, because we wanted for some of the smaller agents, mid-sized agents, to really be involved in the process. To register, you can be a super agent or just a regular agent because it doesn't require any kind of payout, any kind of transaction. All the agent needs to do is just be handy, have his device handy, and do the registration. But once it was time for payout, we noticed that some of the smaller agents ran out of cash. So we had to extend the payout process for an additional day or two. But we learned from this experience to have, just have a super agent that will cover everything. So that was another thing that we had as well. Beneficiaries will come and also forget their PIN code. Now, for anybody to go through the process to withdraw funds, you need your PIN code. The good thing that we did, we had a Cellcom person uh, um, doing the registration and doing the payout process to easily just reset the PIN. Um, but we found that since there's a lot of people who forgot their PINs doing registration, we found that to be an issue. Um, okay. So yeah, we paid out in USD from September to November. We did about two payouts a month, close to about 85,000 US dollars. But the people were paid in Liberian dollars. But it's just for calculations, for easy math, it's been put in US dollars. Okay. So now project solutions. I think Mercy Corp did an amazing job with identification and the monitoring process. They partnered with the YMCA for this process. Mercy Corp came in. They had a list of every single one of the beneficiaries, pictures of the beneficiaries, and they gave each person a specific identification number. Okay, and then with YMCA's duty was to verify these individuals. So once somebody is registered, there's somebody from YMCA to check it off, and then in the back end, once they went back, YMCA and Mercy Corp went back and double checked to see that, okay, if it's the person's name is John Brown is registered with Cellcom only and should not be registered with MTN. So I think that was good to minimize, people getting two payments. I think that was very effective. And then once it was time for payouts, there was somebody there again from Mercy Corp and YMCA to verify the person. Once they received the funds, somebody was there from YNC and Mercy Corp to see the person count the funds to make sure that they received the amount they were supposed to get. So I think that was very good. And later on during the process, we realized, okay, it was necessary to bring on more agents. I think it was better to have more agents present, just to, to minimize the hassle. Because I remember the first two payouts, once the agents ran out of cash, people got restless. Some people have been waiting for an hour or two just to find out, okay, they'll need to come back tomorrow. So we know, we learned from that, and we said, okay, well, we have extra agents present just to handle, if we said we'll do 100 payout to 100 people a day, make sure those people were paid out, and that was good. Customer flexibility on customer service, I think this is key. If there's an agent that I think this also goes back to people forgetting the PIN, issues with SIM card, so all those things, having customer service present to deal with those issues immediately really helps move the process, and then we also took these best practices, and later on applied it to the other organizations that we dealt with. Yeah, and I think NGOs need a lot of staff when it comes to just payouts, especially within the first 2 or 3 payouts, because you need to understand the flow. They need to have people on hand really to help with the identification and monitoring process. So you can't just send one person as an NGO, especially if you're doing a payout to 430 plus people, as we did with Mercy Corp. So I think that was definitely necessary. Stakeholders being present, being in the loop of what's going on, I think is key. Because when we had the agents, we had Cellcom, we had YMCA, as well as Mercy Corp, all present. I think this is so key that each stakeholder knows their responsibility, they know the goal of the project, to ensure that, okay, everybody's on the same page to make this thing happen. I think this was definitely key and definitely helped the success of this payout. Stakeholders awareness and preparedness, I think this was also key, because we had these meetings prior to the registration and prior to the payout. Everybody being on board was definitely it helps. And what Mercy Corp wanted to do, they wanted to sign an additional agreement with the agents just to ensure that the people were treated, the beneficiaries were treated properly, and they received the necessary funds that we're supposed to get. I mean, this was something Mercy Corp wanted, I guess, to show to their donors. But I mean, all in all, the project was definitely successful. The first 1 or 2 payouts, like I said, the challenges earlier, we had some challenges, but once we went to the third, fourth, and the rest of the payouts,
Okay, so I guess I will take over, such as, oh no, Eric is back. Eric, can you try to speak? Because we cannot hear you. We thought it was a connection problem.
okay,
Okay.
yes, a connection problem, yes, yes. So yeah, so now I guess feedbacks. Overall, the beneficiaries, like I said, initially the first 2 or so payouts, because you had the agents run out of cash, and you had people waiting for a long time, the beneficiaries got a little bit restless. I mean, imagine being somewhere for an hour or two and waiting just to find out that, the agents ran out of cash, you need to come back tomorrow. But what we actually did for those people that came back the next day, we gave them priority because first come, first serve. So we gave them priority. Say, okay, you were here waiting out an hour or two yesterday. You will be among the first group that will get served. So those are the ways where customer service and what we did to really uh, kind of ease the process and at least gave the beneficiaries, let them leave with a good feeling for this. Collaboration, preparation, I think that's key for any organization that wants to do this on a major scale. When I say major scale, when you're paying large sums to a large amount of people, it's necessary for you to collaborate. I mean, even if it's a smaller group, it's necessary to really make sure that everybody is on the same page. So what's next? As I said earlier, Cellcom was bought out by Orange. So Smile Cellcom mobile money will be no more. It will now become Orange money, which is great. Anybody that knows about Orange, it's a global company, and they're bringing a lot of resources and capabilities and best practices learned from other countries and applying it to Liberia. So I think it will definitely be good for Liberians as a whole when it comes to using the mobile money platform to send and receive money. Mercy Corp, we've been in talks with them. They're currently waiting for funding from their donors to start their next projects. Since then, we've interacted and have done business with a number of other organizations. Faraway, that's an organization called Lead for Farmers, where we just paid out, I think, about 75,000 US to about, I think, 56 different farmers. This project was for them to, set up the farm, buy equipment, seeds, fertilizer, things like that. We have a couple other organizations, clinics. One of the big hospitals here in Liberia is now using mobile money for patients, where patients can now pay for their expenses. And once we switch over to Orange Money, we'll have the electric company using mobile money to pay for people using mobile money to pay for the electric bills, and you have some gas stations coming on board as well. So the project mobile money makes sense. I see it. I mean, I didn't work with mobile money when I was in the U.S., but coming to Liberia and seeing how it's so easy for you to send funds from one end of the country to another end of the country, assuming that you have a strong agent, I think that's key. And for Liberia, with the two seasons, the rainy season and the dry season, carrying money, and I will say this, one of the security firms that we're dealing with, what they do, they take large sums of money, maybe 20, 30, $40,000 and drive it 3, 4, 5 hours to pay. I mean, that's a huge security risk. It creates a lot of uncertainties. But through mobile money and through proper planning, a collaboration with our agents, we're able to make it, to minimize the risk. When I say minimize the risk, people, they don't need to take cash and drive it 2, 3 hours. They can just leverage the platform and use it. So I think mobile money definitely makes sense, and I look forward to really seeing how this will become the new norm, as it did in places like Kenya, where people first look to see if they can pay with mobile money or transfer, or, pay with mobile money before going to cash or maybe cards and things like that. And in Liberia, I know the central bank is heavily behind this because they want to move towards a cashless society. It makes sense because, they wouldn't have to print, new bills every so often, but with mobile money, everything is done, digitally. I think this would definitely help the process. But yeah, I think that's, my part. I guess I'll look forward to any questions later on.
Okay, I guess that will come at the end. Thank you so much, Eric, for sharing your experience and vision from a service provider point of view. Now we are going to go on the case of Sierra Leone, which is quite different. So let's go over. Okay, so in Sierra Leone, we had prior to the crisis in 2014, and when implementing partners start designing their project, we have only 2 e-transfer services available and only operating in main cities. They were Airtel and Splash. And one important thing to know about cash transfer programming implementation in Sierra Leone within that response is that coordination was very strong, and that to implement cash transfer programming, implementing partners has to follow SOPs, standard operating procedure, which were developed by NACSA, the National Commission for Social Action. And in those SOPs, it was strongly recommended to use offline and online e-transfer as delivery mechanism. So knowing that, that only 2 service providers were doing e-transfer and the recommendation from the SOPs, cash transfer programming tried to implement their CTPs with the 2 service providers, but it appeared that only Splash was able to fully respond to the humanitarian demand. And now Daniel Osei-Antwi, the director of Splash, is going to tell us his experience on that answer. Thanks, Dan.
Thank you, Amandine. Hope everybody can hear me clearly. For Splash, just by way of background, we have been in Sierra Leone since 2009, and when we first started, the initial focus was on the P2P money transfers, but it wasn't until around 2014 that we started really focusing on bulk payments for organizations. And so one of sort of the big opportunities for us around late 2014 was to be part of the payment service providers that were supporting hazard payments for Ebola response workers in Sierra Leone. And I think that was probably the first really big project that brought a lot of attention and also helped us to establish proof of concept for bulk payments or disbursements using mobile money. Okay. So across all of the different interventions that we were involved in, we ended up between 2015 and 2016 supporting disbursements to over 120,000 households in pretty much every district in Sierra Leone. And I think I previously mentioned the health worker payments. In addition to that, we also did quite a bit of work with the NACSA, which is the National Commission for Social Action, which is an arm of the government, which was heavily focused on social safety net payments for various households around the country. Of most relevance in this conversation, I believe, is the USAID Food for Peace transfers. And for that, we were very privileged to work with the 5 implementing partners in Sierra Leone to support their cash transfer activities. Among other things, we also worked with other organizations to make payments to the Ebola survivors themselves. And we also helped to support the vaccine trials where they had to send incentives to different participants over the period of the trials. Next page, please. So just to give some background on how we thought about the best way to make these payments. If you think about the universe of beneficiaries that we have to interact with, I think you will essentially have to place them in one of these 4 quadrants that are shown here. Right? So you're either looking at people who have coverage in their vicinities or people who have no mobile coverage. And among those who have mobile coverage, we have to think about whether they own mobile phones or not. Okay. And for us, for every project that we go into, just by definition, the bias is always to be able to do the electronic payments via mobile money. But I think, especially with these cash transfers that we were involved in, we were really pushed to think beyond the areas where direct mobile money payments are feasible, and to begin to think about different types of solutions for the other quadrants, especially where you have zero mobile coverage and have no option at all with mobile money. And so I'd like for you guys to keep this quadrant in mind as we proceed to think about, to talk more about what we did. Okay. So for most of the payments that we did with the Food for Peace implementing partners, we basically came to the conclusion that we could not use mobile money in a very effective and efficient way. And so what we ended up doing was to develop a new offline payment system where the transfer of money to the beneficiaries, that process itself was done with cash, but then we had to introduce a process of electronic tracking for these cash payments. And the reason we had to do this was that if you looked at the targets that were being selected for these projects, they were mostly, I'd say over 90%, in places where there was, hardly any mobile coverage, or where you would have to travel some significant distances to find a spot with mobile coverage. Now, even in the places that had some sort of mobile coverage, these beneficiaries that were being selected were also the least likely people to own mobile phones. Now, in the past, we had tried something similar to what Eric was describing earlier, where even if the people had no mobile phones, we would find a spot somewhere, within a certain a radius of the community, and set up a pay point where we knew there was mobile coverage. And the idea then was, if you gave these guys the SIM cards and you brought a few phones for them to share, then you could still make the payments electronically and essentially force the issue with the mobile payments and have all of these people put their SIM cards in another phone to do the cash outs. So we had tried this prior to these to the Food for Peace payments, and we realized that it was a very inefficient process, and it was often exacerbated by the fact that most beneficiaries would also forget their PINs. So not only would you have to put the SIM card in a phone, take it out, put it in another phone, take it out, you also needed to reset PINs for a lot of customers, and that process just created a lot of frustration and agitation because it just was really long. So for all of the payments that we did with the Food for Peace partners, we concluded that the most efficient way to do those was through our offline payment system. Now, even with that system, we still had to worry about what kind of distribution network we would be using in these rural areas to support the cash transfers. And fortunately in Sierra Leone, we have a network of I think currently almost 70 rural banks made up of community banks and smaller entities called financial services associations. And these have better coverage in some districts than in others, but we have almost 70 of them across the country. And so in the way we designed our payment mechanisms, these community banks were set up as liquidity hubs for the bulk amounts of money to be stored. And then the idea was that even if we were not going to pay the final beneficiaries with electronic money, we could still send electronic money to our agents who would then cash out at these community banks and then travel with the cash for the last mile to deliver the cash to the beneficiaries. Okay. So that was the design going in, and we were able to implement that in several places, not all places, but we were able to establish partnerships with various community banks where we were able to withdraw larger sums of money for our agents to then move to the final last mile pay points to deliver the cash. I'll talk a bit about some of the challenges that we faced during this further on. Okay. So I think one of the big challenges with this process was that outside of the main urban cities, very often the volumes of cash that we were sending were just way more than any agent could handle, or even in areas where we were using community banks, it was often more than the community banks had in deposits. And so for the most part, regardless of whether we were working with community banks in these rural areas or not, we often found ourselves having to move money into a lot of rural areas simply because we could not source enough cash locally. Okay. Beyond just liquidity, I think also just the availability of these agents in rural areas for us was a big challenge. Many of the areas where we were making payments just did not have enough sort of commercial activity or enough people, businesses with significant commercial activity for us to establish a permanent presence in those localities. And so, what we ended up having to do was to use really a network of roving agents to support multiple localities rather than setting up permanent agent outlets at the locality levels. Now, what this meant was that in any given payment cycle, we would have several agents moving around from one location to another location with cash to make payments based on a fixed schedule that would have been set with the implementing partners and announced to all of the beneficiaries beforehand. Okay, so that process of having to move around with cash from one place to the other in a very telegraphed way, right, where everybody knew exactly what that payment schedule was, introduced a lot of different risks that we had previously not had to deal with. And so we had to come up with various mechanisms to minimize those risks and ensure that the agents that were moving around were doing so in the most secure way possible. Okay. The actual payments themselves, which were being done offline, also needed an accurate way of tracking those payments. And what we did was we basically designed a smartphone-based system just using open source software to enable the agents when they went into the field to, first of all, verify the identities of these beneficiaries, ascertain the amounts that they were supposed to pay to them, make those payments to the beneficiaries, allow the beneficiaries to acknowledge receipt of these payments, and then finally also be able to at least take a picture of these beneficiaries with the money so that we could have that as an additional sort of confirmation of payment. So the way that the beneficiaries were supposed to acknowledge receipt involved them entering their PINs that we had given them beforehand in the smartphones of the agents. Now, similar to some of the challenges that we often have with electronic payments, we realized that a lot of beneficiaries often misplaced these PINs, and it made it difficult for our agents to make payments, because initially we had said that if an agent could not, if a beneficiary could not confirm receipt of payment, the agent could not pay them. Okay, so we had a few challenges where beneficiaries had forgotten their PINs in the field. They were in the bush, and so there was sort of no way to get the PINs. And then because of that, they were not getting paid by the agents. And so at some point, I believe quite a number of the implementing partners recommended that we could just do away with the PIN requirement and just take the photos of the beneficiaries after they had received their payments. Okay. Another challenge that we had, mainly sort of from the period from around May, June to October, was that it was very difficult for our roving agents to move around because of the heavy rains. And I think it's maybe a bit hard sometimes to plan around those things, but that is something that certainly in Sierra Leone, and I suspect in Liberia as well, we will have to be much more cognizant of in future as we plan payment schedules and communicate these to beneficiaries. We just found that it was a really challenging time to move around, given the heavy load that the agents had to carry. Okay. And I'd say another big challenge that I observed was that as much as we would have loved to use mobile money or some other financially inclusive mechanisms to pay these beneficiaries, I think it was quite challenging because it had not necessarily been designed into these projects, right? So sort of the financial inclusion objective had not been designed into these projects as a priority. And so we found that in the end, we just had to be really pragmatic about the ultimate goal of these projects, which was to get cash in the hands of these beneficiaries. I think that if going forward, or if in different project designs, we think more about financial inclusion as one of the key objectives, then it becomes easier perhaps to design mechanisms that bring some of these community banks that are in some of these rural areas into the process in a much more active way. And so while we would have loved to do that in this project, I think we ended up over the course of a year interacting with so many different beneficiaries, but then at the end of all of the payments, we couldn't say that these beneficiaries were now financially included into the formal financial services sector. Okay. And so that was something that I thought was a shame, but I think maybe in future we could design those more proactively into our projects. I think the final challenge that I could think of was just the challenge of being able to make a business case as a service provider for the service that we were providing. If you think about our core mobile money service, which works in a really seamless way, we basically process payments into into recipients' wallets, and they're able to go to agents and they cash out. And there's very little coordination or logistics that we have to do to support those sort of core transactions. In this case, however, we were essentially not only a payment service provider, but we're also a logistics business. And so we had to get into how to move money around, the most secure way to do it, the most efficient way to do it, coordinating transportation. There were just so many things that we were doing in this project that we had never had to do in our core business. And so in the end, it was really difficult to sort of make a financial case for our involvement, given the sort of fees that we were charging for it. But we were able to lean on what I say are more of the intangible benefits in terms of the sorts of relationships that we were able to develop with some blue chip organizations in Sierra Leone. But I would say that was something that was always quite difficult to explain to people. Okay. The lessons that I think we learned in doing all of this stuff was, first of all, that you really can't take a cookie cutter solution and apply it from one market, or even within the same market, from one district to another, or from one type of beneficiary to another. Right? If you look at what we were doing with the hazard payments for health workers, for example, that was over 90% electronic payments. And so that was a very different process than the payments that we were doing with Food for Peace, which were quite the opposite, which was over 90% offline payments. So it's really important that the implementers and service providers adapt to the local context and the types of beneficiaries that they're dealing with. I also think it makes a very significant difference when both sides are engaged from the beginning of the process, because you're able to plan better, you're able to understand the constraints of all sides, and it just makes for better coordination across the board. And I think finally, we very quickly learned that when we're dealing with projects that are targeting the most vulnerable and the poorest beneficiaries, then it's very important to have an offline payment system that complements the electronic payment system. For us, I think over the next couple of years, we expect to be more and more involved in these payments, in these cash transfers, and in some ways it's turned into almost a completely sort of new line of business for us, and we're pushing ourselves to develop new capabilities and new processes, new internal controls to support these types of projects. For this year, by our estimates, we expect to do approximately $15 million, and this has started already with a number of implementing partners. And we hope that they will also see certain improvements this year from the previous years. And then I think one of the most important things that we would like to accomplish this year is to get the community banks, that's the rural banks, as well as the commercial banks, more involved in the delivery of these services. I think if we can figure out a commercial model that makes sense to support a broader partnership, then we will be able to deliver more efficiently across the entire country, and in doing so, I think also be able to accomplish the secondary goal of increasing financial inclusion, which I don't think we have truly been able to do up to this point. And so part of what we at Splash, what we're challenging ourselves to do is to really engage our commercial bank partners as well as the rural banks to see how we can make them more interested in being a part of these projects, and what sorts of additional services we can deliver beyond just handing over cash to the beneficiaries. I think my time is up, so I'm going to end here and maybe lead into questions.
Okay, thank you, Daniel. Okay, let's go to the next part of this webinar, and quickly speaking about weaknesses and opportunity of the overall response and the overall use of technology. Even though all the different stakeholders were really involved, there were some weaknesses, but it's important to highlight. And the first one is the lack of preparedness and the lack of service provider capacity assessment. And this was particularly the case in Liberia, where sometimes the service provider was only assessed in capital level, creating an unexpected situation in the field. And more preparedness could have reduced that. In Sierra Leone, definitely it's obvious that there were a monopoly, that Splash had a monopoly, because they were the only one able to answer to the need of the humanitarian work at that time. But what is important also to mention is that by having so much demand, Splash really pushed its capacity, particularly in the logistical aspect, and that implementers were dependent, which was kind of risky and challenging for the CTP implementation. Okay, so, but what's important to mention is like all that response and the use of technology impacted the digital ecosystem. And I guess when Daniel and Eric were speaking, we can already notice it, that those projects created opportunities in that ecosystem. So if we're taking the service providers, like Orange is entering Liberia by buying Cellcom, but is also entering Sierra Leone by buying Airtel. In Sierra Leone, we have 3 new e-transfer services, GT Bank, EcoBank, and AfriCell, which were launched in 2016. We noticed some changes in regulation. Sierra Leone had no digital money regulation in place before the outbreak, and no regulation had been drafted and should pass in the coming years. For sure, service providers were improving their agent network, because this was a big challenge during CTP implementation. And as example, like in Liberia, Lone Star aims to hire 2,300 new agents per year. As Eric was mentioning, Cellcom aims to contract local super agent with a bigger cash reserve. And Splash would like to play the role of universal super agent in charge of connecting customers with all multi companies which are now operating in Sierra Leone. We can also notice technical improvement, and Lone Star in Liberia improved and bought a new platform to have more transfers, as well as Airtel in Sierra Leone is developing its own platform to deal with more transfer at the same time. Then an important aspect to do with transfer is the improved network coverage. In Liberia, the network coverage has already improved. More towers have been built, and Cellcom is planning to build more towers in the coming years. And in Sierra Leone, the Ministry of Information and Communication has a policy to decrease operator costs to encourage them to improve their coverage at more affordable price. So going back on the weaknesses, one thing which is very important from that case, it's the service provider assessment, which could have avoided delayed and unexpected problem. And to support that, we would like to make the connection with the tool developed by UNHCR, the CDMAT, and Scott Di is going to introduce us that tool. Thanks, Scott.
Okay, thank you, Amandine, and hello once again to everybody. So as a way to address the lack of financial service provider capacity assessment and to help improve future responses, I'll provide a brief overview of the cash delivery mechanism assessment tool, CDMAT as we call it. that UNHCR developed last year, and more specifically by Coco Sasuvi, who's on this call. It's already been piloted and used in several countries, and it's a tool that's intended to help multifunctional field teams, being supply, finance programs, who could have potentially limited cash transfer programming experience, to help them assess the adequacy of various cash delivery mechanisms to meet CTP program needs. As can be seen in the graphic, the CDMAT helps guide the assessment for direct cash payments, delivery through an agent or over the counter, prepaid cards, smart cards, mobile money, and bank accounts. It does not cover vouchers or innovative solutions such as common cash facilities or delivery mechanisms. The CDMAT can be used as part of CTP preparedness activities and is actually recommended to use during that stage. Because as we know, if we use it during the actual response, the response can be delayed. It's also for use during the response analysis stage to help determine if it's possible to deliver cash, and then during the program design phase to determine the best type of delivery mechanism, be it banks, prepaid cards, etc. It serves as a precursor to and informs the formal procurement process, and any subsequent request for proposal can then be targeted towards the specific type of provider identified by the CDMAT. It was designed as a companion to UNHCR's operational guidelines for CBI, with a specific focus on assessing the appropriateness of a delivery mechanism for a given cash transfer program. But it can also align with the operational guidance for cash developed and practiced by other organizations, such as yours. The tool is available to all partners organizations, which can adapt it for their own use, and it's available on the CALP website under Resources and Tools, as well as the UNHCR website under What We Do Cash-Based Interventions. The CDMAT follows the program cycle and begins with a review of the response analysis phase to choose the best modality or combination of assistance, and refers to the operational guidance for CBI for additional information such as the key considerations and essential questions relating to cash delivery options. So they're meant to be used in tandem. And the operational guidance for CBI is also available on the UNHCR website. The CDMAT then presents this high-level decision-making tree that you see here on the slide. And this provides an initial framework for considering different types of delivery mechanisms by asking the most fundamental questions to help a country team to decide upon which type of delivery mechanism they should focus on for a more detailed assessment during the program planning phase. Then for each cash delivery mechanism, banks, mobile money, etc., guidance and a more detailed decision tree is provided in the following sections of the tool. During the program planning and design phase, the process for assessing cash delivery mechanisms and selecting a financial service provider is detailed in the tool. In this section of the CDMAT, for each of the 5 points listed in the graphic on the slide, the key considerations and issues are also explained in the document to help guide the user through the assessment process. So besides providing the background information on determining the objectives of the program or key considerations, it also provides information on how to analyze the financial landscape of the country, including the regulatory structure and the adequacy of commercial offerings for financial services. The CDMAT also reminds us that when selecting a service provider, this tool should be used with flexibility and, of course, adapted based on the context. And when selecting a service provider, additional considerations are highlighted in the tool, such as the need for conducting a data protection impact assessment when we're transferring data on the beneficiaries to the financial service providers. And then for each type of cash delivery mechanisms, banks, prepaid cards, etc., an individual decision tree is proposed. So there's actually 6 of these, and this is the example highlighting the bank account decision tree. And before each individual decision tree, there is a narrative, an overview of the basic elements to consider regarding bank accounts or prepaid cards, for example, and its individual features, key considerations, and issues that you should be aware of related to that type of delivery mechanism. These individual decision trees then help guide the user to determine the suitability of a given delivery mechanism by asking the key questions that would need an affirmative response to proceed with that type of delivery mechanism. If there is a negative answer, as you can see, it provides questions relating to potential workarounds. If still negative, then it recommends the user to investigate another type of delivery mechanism. Next, an assessment checklist provides an overall framework to conduct a detailed assessment of a specific type of delivery mechanism, including key indicators, sources of information, and additional areas to investigate. There are also a series of linked tools in this document and on this page that are provided with the key areas to be investigated in detail to support the final decision making. This includes an interview guide for financial service providers and a regulatory information questionnaire. And finally, the last step in the CDMAT is the assessment scoring sheet, which is a linked Excel file within the PDF. And following an interview with a potential service provider, a total of 49 questions relating to the following assessment categories are answered. And these are the user registration and experience, the financial service provider capacity, including items such as issues such as operations and management of the provider, their speed, resilience, capacity, liquidity, etc., service and controls, such as information security, controls and risk management, questions related to data protection and compliance with internal policy, cost efficiency, such as the cost to the organization, the implementing partner or agency, as well as the cost to the beneficiaries, and the ease of implementation of this particular type of delivery mechanism, such as the processes, the flexibility and scalability of the financial service provider. The answers that are entered into the mechanism, yes, no, or not applicable, will provide a numerical value, as you can see here. For most answers entered, a specific recommendation will also be shown describing additional actions or lines of inquiry to be taken, along with any red flags and potential mitigating measures. The total score received out of a potential total of 100 will render the verdict of the assessment, where the possible results are definite yes, definite no, and yes conditional on a more in-depth assessment. But please note that the scoring of the assessment is suggestive of whether or not the delivery mechanism is feasible according to how well the service provider meets the key criteria, and the multifunctional team would then take this scoring into consideration along with any other information and contextual analysis, etc., to determine whether or not to proceed further, which could include launching a request for information to the service providers or a request for proposal for any particular type of cash delivery mechanism. In addition to all this, there is a glossary on key terms, references, and recommended reading are included. So that concludes the overview of the cash delivery mechanism assessment tool, the CDMAT, developed by UNHCR and available to all. And I would encourage you to download and review the tool in its entirety and to use it in the preparedness or any future responses. So I'll now turn it over to Amandine to guide the Q&A portion of the webinar.
Thank you very much, Scott. Yes, thanks for mentioning that that we can download the tool. So a presentation will be available online very soon, and we'll also give a link to the tool, and as well as some contact. Just before starting the Q&A session, I can see that we have having some questions. So if you guys want to start writing questions that are pending, we will be answering it. We just wanted to mention that this webinar was an opportunity to show a little bit the perspective and the point of view from the service provider, and to see what happened from their side, but also to show that that despite a very complex context, the use of technology was useful and worked, and e-transfer would in theory have been an ideal means for cash transfer programming, given the low level of movement and interpersonal contact required. But it's important to know that implementing cash transfer programming, e-transfer at scale in a rapid manner requires detailed map of the capacity. And in that context, the CDMT, the CDMAP tool presented by Scott, could be very useful to check the adequacy of the delivery mechanism used with the program objective and to assess service provider capacities. Okay, so we will start with a question. Let's take the let's take the last one from Leslie. How long does the CDMAP process take ideally? Scott, I let you answer that one.
Well, I don't have a definitive response as far as number of days or weeks, but it first a mapping of the financial landscape and potential service providers would be needed, and then you could use the tool to help gather the information and guide the assessment process. So it could be, most likely it could be done within a few days, a week, I would think, and then you to do the initial analysis, and then you would need to reach out to the service providers and to set up an interview to conduct a more detailed assessment and find out additional information. So I would think within within a month you could complete a rather complete assessment of the potential ways to deliver cash in a country.
Thanks, Scott. I hope it's answering. We have another question from Abu Yarma from World Vision in the US. This is mainly for Daniel, I will say, such as I cannot see Eric anymore. Daniel, how did you mitigate or secure the data privacy? Were there any issue with hacking?
This was not. It wasn't a big issue for us. I don't think we had to do much more than our normal. For the offline payments, the way it worked was we would typically get the payment lists from the implementing partner, and these would get uploaded to our server for distribution to the phones that were being used to make the payments. And so that process was done using some normal open source ODK software. And let's say if the agent knew what to do, they could go into the mobile phones and get beneficiary data because these were basically just preloaded into the phones. But it wasn't something that we were too concerned about or that we did anything special about. For the data that sits on our server, that obviously can only be accessed by authorized administrators who have login credentials. And so for that also, and that's a secure system that we've been using for years, and we've never had any problems with hacking and didn't expect to have any problems with hacking. And so we didn't do anything special.
Okay, thanks, Daniel. We have another suggestion from Brenda Lazarus. We think for discussion at the end, it sounds like these programs all took place after the peak of the Ebola outbreak and involved beneficiary assembling to varying degree to register and receive their payout, looking forward if some type of similar disease had been feasible to conduct. The peak at disease outbreak when the assembly of people in public suggestion of technology can be used of cash program programming under this scenario. Sorry, I read kind of quickly. So, Brenda, you're totally right. Most of the projects were implemented after the peak of the crisis. They were not implemented at the same time in both countries, and it was not even like at the same time in countries. Most of the project involves people assembly, but the Ebola protocol was was really followed, because you could not implement any of those projects without following the Ebola protocol, meaning that even if you assemble some people, they cannot touch each other, and you have to follow that protocol. But this is really a good point, and this is why we're happy to see also that the ecosystem is evolving, and that e-transfer could be normally be done like more easily in the future. And this is why as well the offline application developed by Splash was a good solution to really reach the communities, and each communities, and limited the number of people gathering. So I hope I answered the question.
This is Daniel. I would like to maybe add some insights from
Sure.
the peak of the outbreak. When we were doing payments to Ebola response workers. So during that period, we were obviously very concerned about big crowds and people rushing to agents. And for those, we were doing these payments by mobile money, and we often encouraged these health workers not to all just leave their post and go and cash out at the same time when they got their money. But invariably, that's what happened all the time. As soon as people got the money in their phones, they would all rush to the agents to do their cash outs. And so even when we were doing mobile money, we were having huge issues with big crowds. And so we had to start making the payments actually on a rolling basis, so that not everybody got their money at the same time. So we actually had, and we were doing those payments with both Airtel and Africell, and we actually had to agree on a sequence for these payments, and across all of the different districts, to make sure that we didn't have these issues where people would suddenly rush to the agents when they saw their text messages. We also had to train all of the agents on some basic, Ebola, sort of protection protocols, and so everybody had to have one of those buckets, and with the chlorine, we had to put some ropes around the pay points to manage how many people could actually go into the payment zone at once. So there were a few things that we had to implement to ensure that our agents, as well as the beneficiaries themselves, stayed safe during those payments.
Daniel, for completing the question. For completing the answer, sorry. So one other question from Abu Yarma, again from World Vision US. I guess, Daniel, this will be mainly for you, because Leslie Mara already answered to that question. And the question is, mandatory registration or prepaid SIM card user is a policy adopted by a number of countries over the years. Any idea if this policy impacted the beneficiary of CTP?
So in Sierra Leone, even though that policy has been in place for a few years, the enforcement of it, I think, has been fairly weak. And so we, certainly for the payments that we were making that were going to mobile phone numbers, we did not in any way rely on SIM registration data. Right, so we were relying on data that was being provided by the implementing partners, and we were just verifying those in the field, and that included all of, because we were part of the registration process for most of these projects, and so we went into the field with the implementing partners. We did the registrations, we took photos of all of the beneficiaries, and essentially had to basically build our own profile of these beneficiaries along with the implementing partners, so that we could do those verifications when our agents went into the field. We didn't have to depend on SIM card registration data at all.
Thanks, Daniel. I guess this is for Eric and Daniel as well. What were the challenges and opportunities during electronic tracking? If you have any specific that you would like to mention and develop on.
I'm sorry, can you repeat what you said? Hello?
So, yeah, sure. What were the challenges and opportunities during electronic tracking from the service provider point of view?
In regards to tracking, I think we didn't really face, a lot of challenges when it came to tracking, because once payments are, sent out, we see instantly, okay, if everything was successful, if maybe a number was not registered, we see it in our system. So, I guess in regards to tracking, I guess, can you elaborate more on when you say tracking? Like, what do you mean by tracking?
I guess the idea behind is like the tracking that you need to do for the reconciliation.
Okay. Yeah, because usually once payments are made, we see in our system, okay, what payments were successful, what payments did not go through. So from there, there was no issues, when it comes to reconciliation. We didn't have issues regarding that.
Okay. Daniel,
Okay,
would you like to
so
mention?
I'll add, sure, I'll add to that. So for mobile money, for payments that are being done by mobile money, it's very straightforward. Everything is tracked on our platform. I'm sure it's the same for Eric's, and you see everything down to the timestamps for when payments have been delivered, when they are actually cashed out. All of that very straightforward. For the offline payments, it was a bit more difficult because basically what happened was our agents would go into the field with preloaded smartphones, and they would do everything offline on the smartphones. So there was a bit of a delay between when payments were completed and when the data from the smartphones were submitted back to us to complete reconciliations. So that was a bit challenging, to the extent that people, will always prefer to get that data in real time or near real time. Okay. In the new rounds of payments that we have just initiated, where at least for Save the Children, and I see that Leslie has mentioned it here, we are working with an organization called Segovia, which essentially has a cloud-based information system that we can upload to directly when our agents leave the field and come into places with coverage. So the work hasn't changed too much in the field for the agents, except now they're actually using QR code scanning logic when they're in the field to scan. Every beneficiary has an ID card. It gets scanned by the agent using the agent's smartphone. And then along with that, all of the other processes for acknowledging receipt are still in place. All of that happens offline, but with the Segovia system, we are now able to immediately upload from the smartphones to Segovia's server, which they then use to generate the reports that they deliver to Save the Children. So there's a bit of an improvement from the previous rounds of payments where the delay between end of payment and submission of report was much longer than now. for offline payments.
Thanks, Daniel. So we are going to the end. Maybe one more topic that came several times in the question is the involvement of communities. How communities are involved to implement the different solutions, what are their feedback, and how do you manage that? Daniel, Eric, would you like to share any experience on that?
Yeah, so in regards to, I know with Mercy Corp now, we had a community leader along with the YMCA assemble, the 400 plus people on specific days to come in. They were aware of, okay, what was happening for the project. And I think they did a good job at, scheduling people on specific days to come. Of course, some people came, they wanted to be first, and they came before certain days. They came on days that they were not supposed to come on. But I think getting the community involved, I think, was definitely key. And what we did with our last payout with an organization called LEAD, that was an organization of women farmers. So I remember previously, we met with our lead. It was Cellcom, the lead, and the lady that represented the women's farmer met together, and she definitely organized the other 50 plus women within the group to tell them, okay, at this specific day, Cellcom will be with X amount of agents for a payout. So, I mean, we understand. I mean, it goes back to getting all the stakeholders involved. I mean, a community leader, a community group, is one of those stakeholders. And I think in order for any of these projects to be successful, like I said earlier, all stakeholders must be on the same page.
Maybe Daniel, if you want to add something, but more in regards also to the use of the technology, which was something new for the beneficiaries, do you think you can include that in your answer?
So you mean as it relates to community involvement?
Yes, such as like the solution, the delivery mechanism was mainly new for the beneficiary. How did you deal with that?
Yeah, so one of the things that was really helpful, I think, with the projects that we were involved in, is that the implementing partners themselves were very engaged with the communities, and so I think even right from the registration stage, we had already explained how the process would work, and a lot of these beneficiaries already knew what to expect. But I think during the payments themselves, it helped to have the community members there, certainly when it came to supporting identification of beneficiaries. Sometimes if a particular beneficiary had not shown up, maybe because they were sick or in some cases because they had passed away, then you would have maybe an alternate show up, but who would not be known to us because that's not the person we would have seen during the registrations. So the community members themselves were very involved in helping to ascertain the identities of people who were coming in as alternates. And also to your point on the technology piece, I think the person that was really interacting with the smartphone in our case was the agent, right? The beneficiaries only had to provide their PINs and pose for a photo with their money. So there really wasn't too much of an intervention there from the community members. But I think what helped was that they embraced the process and allowed it to go smoothly without maybe just agitating for their money and saying all we want is our money, which in the past we've had some issues like that with mobile money. When you go to certain places, they don't understand why they have to send a message, why they have to remember their PINs. They just want you to give them their money. I think in all the communities that we went to, people really embraced what we were doing and didn't give us too much of a hard time around giving us their pins or posing for photos with their money and all of that. So that I'd say was a big plus.
Thanks, Daniel. So this is the end of the webinar. We would like to thank you all for your participation. We're hoping that you enjoy it. We will be putting soon the presentation online as well as the link for the resources, including the CDMAT tool. And if you have any question, we will put also a contact at the end, like that you can still reaching us in case of more information needed. Thank you so much for your participation. Have a nice evening for some and a nice day for the other.
Okay, thank you.